Congratulations, you have just started your aligner treatment. This video will go over the following about your aligner treatment. We will be first going over a short introduction to aligners. Then we will go over handling your aligners, which includes fitting and removing your aligners and caring for your aligners. Then we will be going over wear protocol. For your aligners, which are also called trays, or by brand name Invisalign, are custom-made appliances designed to straighten your teeth. They are fabricated using a medical-grade BPA-free polyurethane material, which is developed specifically for aligner application. Initially, most patients will have some trouble removing and replacing their aligner. Over time, you will begin to develop your own way of removing the tray and will become more efficient during removal. The aligners have a wide but limited degree of flexibility and memory, so it is important you handle them gently. Be careful not to bend or twist the plastic in any way that may deform it. Here are some tips on tray removal. Make sure you wash your hands with soap and water before handling your aligners. Start by getting under the tray toward the back teeth. In many cases, it is easiest to start with one side of the back teeth. Use your fingernail to lock on the tray and gently pull down. Identify the attachments, which are two-colored bumps on your teeth added by the orthodontic assistant or orthodontic team. These attachments provide retention to the tray. It is easiest to focus on dislodging the tray from the attachments in order to remove it. For those with aligners that are difficult to remove, it may be helpful to use a aligner removal tool pictured here. Here are tips on fitting your aligners. Aligners are easiest to fit by placing the front teeth in the tray first to make sure that they line up. Then seat the back teeth until the trays snap. Always use clean hands and use your fingers to seat the tray onto your teeth. Do not bite the aligners to seat them. Look in the mirror to assess the fit of the aligner. In some situations, you may see some space between the tray and your teeth where the aligners need to be seated even further. Chewies are bite cushions that can help to seat the tray tighter where these spaces may occur. We recommend that you try removing and replacing your aligners at least once with minimal assistance before concluding your appointment with us. Cleaning your aligners. Brush your aligners with your toothbrush, soap, and water twice daily. You should use a regular toothbrush and not an electric one. Avoid using toothpaste to clean your aligners because they may cause streaks in your plastic aligners. We recommend brushing your aligner after every meal before reinsertion. At minimum, clean your aligner once in the morning and once at night. Do not boil or use household cleaning material to clean or disinfect your aligner. In some situations, stone buildup may collect on the aligner and cannot be brushed off. In this situation, you can use cleaning tablets such as Retainer Bright or any denture cleaner. Stone comes from minerals in your saliva, and some patients may have more than others. Cleaning tablets break down the stone so that they can be brushed off easily. To use the tablets, place one in a glass of water and let it dissolve. Once it has been dissolved, place the aligners in it for about 15 minutes. You can then take them out to brush with a toothbrush. For optimal results, you must wear your aligners approximately 22 to 23 hours a day, removing them only during meals, when drinking liquids other than water, and during brushing and flossing. Compliance with wearing the trays is very important in attaining the desired result. After your meal or snack, it is best to brush your teeth and your tray and then replacing your aligners on your teeth. The research shows that the optimal amount of tooth movement occurs after 4 hours of continuous wear. Therefore, it is best not to continuously take out the aligners. Always wear the aligners to sleep. Typically, clear aligners are replaced with a new set every 10 days. In some cases, the aligners will be switched every 1 to 2 weeks to guide the movement of your teeth. The doctor will determine the best time to switch your trays. Our office partners with Dental Monitoring, an at-home scanning platform equipped with a scan box and retractors. We will cover more on dental monitoring in a separate video. When moving to the next aligner, you will feel some active pushing or tightness on your teeth. Over time, as the teeth begin to move, the aligners will feel less active and more passive. When the aligner feels fairly passive, it is time to move to the next aligner. The number of aligners can be found on the left side molar or premolar as a raised print. Each bag will have their aligner number printed on the bag. We also recommend you do not throw away your older aligners through the duration of your treatment. Keep the existing bags for organization. In some instances, when teeth are not tracking, we may have to backtrack to the best fitting aligner and move forward from there. Emergencies and discomfort. Sometimes there may be sharp corners that may be irritating your lip or your cheek. These can be easily smoothed out when you are still in the office. If you're at home and realize that there is a sharp corner, these areas can be relieved at home. If you were not given a nail buffer or file, one can be easily attained at the store to soften and smooth areas of irritation. For longer edges that may be sharp against the gums, a small pair of scissors can be used to remove the sharp edge. You may also notice a pack of wax in your starter kit. Wax can provide temporary relief from sharp edges. It is not uncommon to begin feeling soreness in some of your teeth as they begin to move. If your teeth begin to feel sensitive, we recommend eating soft foods. You can also take over-the-counter pain reliever such as Advil or Tylenol to reduce discomfort. To relieve persistent discomfort, make sure to take the recommended dosage. Please read all instructions on the label before taking medications to see if it is right for you. As the teeth begin to move later in your treatment, moving to your next aligner set usually will not result in the sensitivity as the first set trays. There may also be situations where aligners are lost and broken. In most cases, the next set of aligners can be advanced early. In any of these situations, please contact our office for instructions. It is important that you bring your current set of clear aligners to each of your appointments. You may also experience excessive saliva when you start your aligner treatment. This is normal as your mouth is getting accustomed to your aligners and should not last longer than a few days. You may notice some sounds are harder to pronounce, but you will adjust to speaking with your aligners very quickly. We congratulate you again for starting your journey toward a great-looking smile with aligners. We are happy you chose our practice, and we are here for any questions and concerns through phone, text, or email. By phone or text, you can call us at 703-780-1418, or you can email us at ao@myalexandriaortho.com.